Every day in medical care facilities across the country, healthcare professionals treat thousands of finger injuries. In most cases, treatment consists of a plaster cast to stabilize the jammed or fractured finger so it can begin to mend. Or a tongue depressor or plastic splint may be taped on. Each of these traditional methods requires taping and straps and comes with distinct disadvantages. Patients almost universally wish there was a better way to protect their fingers. An orthotic device that is comfortable, fits properly, and corrects the problem it's designed for. There is an orthosis that meets all these criteria and more. Oval 8 finger splints from 3-Point Products. The Oval 8 finger splint is the orthotic device that solves the problems inherent in traditional splinting methods. The broad bands of the Oval 8 distribute pressure for wearing comfort. It's a 3-point pressure design that adheres to a classic tenet of orthopedic treatment, that it takes 3 points of pressure to stabilize or realign a joint. When properly fitted, the Oval 8 finger splint generally requires no taping or strapping. This open-air design allows the skin to breathe, eliminating the problem of skin maceration and leaving the fingertip free for function. And the angled band allows wearers to adjust the tightness to accommodate changes in swelling or temperature with just a quick reversing of the splint. Sizing Oval 8 splints correctly is critical to a proper fit and successful treatment. It's also extremely easy to do. Oval 8 sizing corresponds to, but is not an exact match for, U.S. jewelers' ring sizes. The provider chooses the ring gauge that fits straight around the joint, and then chooses the corresponding Oval 8 size. Each Oval 8 splint has size adjustability designed in. The angled band allows each splint to fit a full ring size or a half ring size, depending on which end of the splint slides onto the finger first. Oval 8 splints can be adjusted using a precision spot heat gun available separately to position the finger in up to 20 degrees of flexion or hyperextension. Carefully heat the Oval 8 where the band and oval section meet. Pressure on the heated bands will decrease the depth of the splint and alter the angle at which the splint holds the finger. Let us show you just how Oval 8 finger splints can be used to treat some of the most common finger problems seen by healthcare providers. Mallet finger injury results in a loss of extension at the DIP joint and requires splinting the joint in extension for 4 to 8 weeks. Fitting an Oval 8 to hold the DIP joint straight takes a matter of seconds. In acute cases where swelling is expected to go down, issuing 2 splints, one to wear on the way out of the medical office and one to slip on if that gets loose, assures continuity of treatment. Untreated mallet fingers can develop into a secondary deformity known as swan neck deformity. The PIP hyperextension seen in swan neck deformity is also a common problem for people with rheumatoid arthritis or ligament laxity. Using an Oval 8 splint on the PIP joint is an easy and effective way to block hyperextension and restore balance to the tendons and ligaments in the finger. Deviation of the DIP and PIP joints caused by the buildup of bony nodules in the hands of patients with osteoarthritis is a common and often untreated problem. To reduce this deviation, the Oval 8 band is fitted on the side of the joint, and the oval section applies the opposing corrective force to realign the fingers and reduce stress on the joints. To hold the PIP joint straight in order to treat boutonniere deformities, jammed fingers, or non-displaced fractures, use one Oval 8, or double them up by using one larger size on top of the next smaller size. Trigger fingers can often be successfully treated by limiting finger flexion after or in lieu of an injection. Worn with the oval section blocking the PIP joint, ovalate splints can be used for rest at night and during the day as needed. Different conditions, each treated successfully, cost-effectively, and comfortably with just one type of splint. Ovalate splints from 3 Point Products.